I was born with tetralogy of flow with absent pulmonary valve syndrome. So when I was 5, I had my first procedure done, and they put in a pulmonary valve. And then when I was 15, they went in and replaced that one, and I've had that one in up until now.
Melody valve is a catheter-based implantable valve that can replace a dysfunctional pulmonary valve, and can be done by going through the venous system through a skin access point in the leg, and avoid the patient having to have open heart surgery to have valve replacement. So the first part of the case is always this fairly involved diagnostic assessment of the outflow tract itself, to make careful measurements and know everything is the right size, and to know that we won't be impacting something in a bad way. Once that is done, then we need to prepare the landing area, the landing zone of the new valve. We need that to be uniform and round, and of a length that is appropriate for the valve, and that's done with a combination of high pressure angioplasty balloons and stenting to get that a uniform caliber and of the right size and length for the valve. And by doing that, we protect the valve so that the valve itself doesn't have to exert that pressure to maintain the length and shape. It only needs to open and close. And the other prep work that we do creates a safe landing zone for it. There's a series of washes that we do because of the way the valve is treated to preserve it for use. So we have a series of baths and washes that we do, and those are all timed and specific. And then the valve, because it is sewn and prepared in the expanded shape, we have to then manually crimp it down onto the balloon catheter to give it the low profile to go inside the delivery system. And so it needs to get down to a size of less than 7 millimeters, which we just do by gradually lengthening it and pushing it down so that we get it on the balloon properly. And then the final step, which is the most exciting, is putting the new valve, the stented valve, within that prepared area and seeing the new valve go up. And immediately upon deflation of the balloon, the valve starts to move and restores full function of the valve, which we then test with pressure measurements and a final picture to show that he's now got a competent valve in place and all the blood is going forward only instead of forward and backward.
It just felt like my heart was pumping so much easier. You know, I don't know if a lot of it was mental, but it was crazy. I could feel an immediate difference.
It's one of the most gratifying procedures we do, to know that just a few years ago these people would have had to have another open heart surgery, and to be able to give them the exact same valve product and see it work immediately. And then, you know, they wake up after the procedure and they're talking to you, and they're getting up and going to the walk around the hallway that night and home the next morning. It's just remarkable. It's very fulfilling.
Just, I mean, a crazy relief, like not, you know, having to be cut open again through my chest. You know, I have a big, like, 10-inch scar here. Today I'm leaving with just a little, I mean, it's about a centimeter that they went through my thigh. You know, the last surgery I had, at this time, I couldn't even get out of bed, and now I'm leaving today after just one day. It's crazy, you know, how far they've gone in the last 12 years.